Dr. William Schaffner is an infectious disease specialist. He's also a professor at the Vanderbilt Medical Centre in Nashville, Tennessee, and Dr. Schaffner joins me now. So, sir, walking pneumonia, what exactly is that? How serious?
Well, Andrew, walking pneumonia is an old-fashioned term that refers to the milder forms of pneumonia. There are many people who get mild pneumonia who see their doctors in their offices, the doctors examine them and then treat them and don't need hospitalization. So fortunately, this is on the mild end of a pneumonia infection.
And so that's the distinction between walking pneumonia and just regular pneumonia, where in fact you do have to stay in the hospital?
Yes, it has to do with severity rather than anything else, right?
Okay. So Clinton, she is 68 years old. So how will that manifest in someone of her age compared to a younger patient? Do you worry about it a little bit more with someone over 65 in their late 60s than you would, say, someone in their 40s and 50s?
Well, people who are older are more prone to get pneumonia than people in their 20s and 30s. However, Secretary Clinton doesn't smoke. She doesn't have underlying chronic lung disease or heart disease. She doesn't have diabetes, so she doesn't have those other risk factors for a more severe pneumonia. We would anticipate that she would get better really quite promptly. Doctors take care of this kind of illness all the time, and patients, generally speaking, do very well, fortunately.
And so how soon, when you say she should get well soon, how soon do you think?
Well, I'm not there at the bedside, as it were, but generally patients start perking up really within 2, 3, 4 days, depending upon their background level of energy and exactly how severe their case of pneumonia was.
You know, I mean, my mom is 69. I can't imagine her having the kind of pace and schedule that Hillary Clinton has. I mean, it's just breakneck. Do you have concerns about that? That you can just, you're flying across the country all the time, all of these events, you're speaking to the media all the time, you're getting questions from reporters. I mean, you know, it's hard to imagine that kind of schedule, the impact it would have on someone half her age.
Well, of course, it's very arduous and stressful. And indeed, all of that personal contact, face-to-face contact and much shaking of hands, that probably predisposed her to a viral infection. You know, she had a cough illness that was lingering. Thought to be allergy, probably a viral infection, and that viral infection then developed this complicating bacterial pneumonia. That's a very common scenario.
I just wanted to move away from the pneumonia a little bit because I know infectious disease is your specialty, but you are a medical doctor. And so I want to ask you about some of her other situations, the blood clot and the concussion. Do those worry you?
Well, they worried us in the past, of course, but she apparently has recovered completely from those. Those are now more in the distant past. They're certainly not predisposing her to pneumonia. You know, all of us, as we get a little older, we pick up a little mileage and a little scarring along the way. So those things don't worry me, really.
But not all of us are running to be president of the United States. Arguably, perhaps the most stressful job in the world. So, you know, from a medical perspective, what do you make of that in terms of what we've seen from Hillary Clinton's health?
Well, I would have said and continue to say that both candidates look to be enormously vigorous, and they're out there probably outpacing the majority of us, working very hard on a day-to-day basis. So unless their medical records, which they're going to release, I gather, have something in them that we don't know about that's serious, I would think that from a health point of view, they're likely both up to the job.
I know you're a doctor, but I have to ask you this. You know, there's doctor-patient privilege, but in this case, do you think that Donald Trump and Hillary Clinton should make everything about their medical history transparent and public, not just little bits, but everything on record?
I do believe that because they're extraordinary and things have changed. Our expectations have changed over the past decades. In this day and age, yes, I think those medical records with an evaluation by their regular physicians ought to be released so that we could all have a look at it.
And why is that? Why do you think that?
Well, because people with underlying medical problems can have implications for their expected functioning over the next 4 years. And we know that we have had leaders with underlying medical problems in the past.
Sir, it was great of you to take the time. Thank you very much.
My great pleasure, Andrew.
And that's Dr. William Schaffner at the Vanderbilt Medical Centre in Nashville.